Three-dimensional or 3D animations are truly remarkable tools. They bring images and concepts to life right before our eyes. Think of them as moving digital sculptures. These animations can show complex systems in a way that flat pictures or words alone simply cannot achieve. They create depth. They add movement. This makes learning much more engaging. It also makes understanding easier for many people, especially visual learners. We are seeing them used more and more in many fields. Education is one of the most important areas where they are making a big impact, changing how we absorb information. Why are 3D animations so effective in education? Well, our brains are wired to process visual information very efficiently. When we see something in 3D, moving and interacting, it captures our attention. It helps us build mental models of complex subjects. This is far more intuitive than just reading text in a book. For instance, imagine trying to understand how a car engine works just from a diagram. The human heart is an amazing organ. It is truly a marvel of natural engineering. However, its complexity can make it very difficult to understand fully. Its chambers, its valves, its intricate network of blood vessels, and the rhythm of its beat are all part of a dynamic system. Textbooks can show us diagrams, of course, but these are often flat and static. They cannot easily convey the constant motion and the three-dimensional relationships within the heart. Trying to imagine how blood flows, how valves open and close in perfect synchrony, can be a real challenge for students. This is where the power of 3D animation really shines. It offers a new window into this vital organ. 3D animations allow us to peel back the layers of the heart virtually. We can see the four chambers, the atria and the ventricles. We can watch the valves, the tricuspid, pulmonary, mitral, and aortic valves, opening and shutting with each heartbeat. We can follow the path of blood as it journeys through the heart and out to the rest of the body. These animations can clearly show oxygenated blood in bright red and deoxygenated blood in blue. This visual distinction is incredibly helpful. Students can rotate the 3D model. They can zoom in on specific structures. They can even see a simulated heartbeat, making the learning experience incredibly vivid and memorable. Beyond the classroom, 3D animations of the heart are playing a crucial role in advanced medical training. Imagine surgeons preparing for a complex heart operation. They can use interactive 3D simulations to practice the procedure beforehand. These simulations can replicate specific patient anatomies derived from scans. This allows surgeons to plan their approach, anticipate potential challenges, and refine their skills in a safe virtual environment. It's like a flight simulator for pilots, but for the delicate art of heart surgery. This kind of preparation can lead to shorter operation times. It can also potentially reduce risks and improve patient outcomes. It's a powerful tool for honing surgical precision. Another vital application is in patient education. When a doctor needs to explain a heart condition to a patient, words alone can sometimes be confusing or frightening. Medical jargon can be overwhelming. A 3D animation, however, can make the explanation much clearer. Doctors can use these visual aids to show patients exactly what is happening inside their heart. They can illustrate the nature of a blockage in an artery, for example. They can show how a stent might be placed to open it up, or they can demonstrate how a valve replacement surgery would work. This visual communication helps to demystify complex medical information. Consider a patient diagnosed with atrial fibrillation, an irregular heartbeat. The doctor could use a 3D animation to show the heart's normal electrical conduction system. Then they could show how, in atrial fibrillation, the electrical signals in the atria are chaotic. The patient can see the irregular quivering of the upper chambers. They can understand why this might lead to symptoms like palpitations or increase the risk of stroke. Looking ahead, the future of 3D animation in medical science, especially in heart health, is incredibly bright. We can expect to see even more detailed and interactive animations. Imagine animations that integrate real-time physiological data, or custom animations generated specifically for an individual patient's unique anatomy and condition. As computing power increases and software becomes more advanced, the level of realism and interactivity will continue to soar. We might see virtual reality, VR, and augmented reality, AR, playing a bigger role, allowing doctors and students to step inside a virtual heart for an immersive learning experience. The possibilities are truly exciting. One of the most promising developments is the potential for creating highly personalized 3D heart models. Using a patient's own medical scans like CT or MRI data, doctors could generate an exact 3D replica of that patient's heart. This digital twin could then be used to plan surgeries with unprecedented precision. Surgeons could even practice complex procedures on the patient's virtual heart before ever making an incision. This personalized approach could significantly reduce surgical risks. It could also help in designing custom medical devices or predicting how a patient might respond to certain treatments. This is the cutting edge of personalized medicine. The importance of heart education cannot be overstated. Heart disease remains a leading cause of death globally. Educating the public about heart health, risk factors, and symptoms is crucial for prevention and early intervention. 3D animations can make this vital information more accessible and engaging for everyone, not just medical professionals. Imagine interactive apps or public health campaigns that use compelling 3D visuals to explain how lifestyle choices impact heart health. This could empower individuals to take better care of their hearts. It could help people recognize the warning signs of a heart attack sooner, potentially saving lives. In conclusion, 3D animation technology is revolutionizing how we understand, teach, and treat conditions of the human heart. From enhancing student learning to improving surgical planning and patient communication, its impact is already profound. As this technology continues to evolve, it will undoubtedly unlock new ways to visualize, diagnose, and manage heart disease. It offers a clearer view into one of our most vital organs. By making the complex comprehensible, 3D animations are not just changing medicine. They are helping us build a healthier future, one animated heartbeat at a time.